Major changes to Social Security are coming in 2025, and these shifts could affect how much you receive, how much you pay, and the future of the system itself. In this video, we're diving into the new Social Security Fairness Act, a cost of living adjustment, tax proposals, and even the potential risks of Social Security's insolvency. If you want to understand how these changes will impact your financial future, stick around until the end. Welcome to Financial Area, where we break down all the important financial news you need to know. Don't forget to like, subscribe, and hit the notification bell so you never miss an update. The Social Security Fairness Act, passed in 2024, is set to bring significant changes for public service workers starting in January 2025. This legislation aims to correct the inequities in Social Security benefits that have long affected certain groups, particularly those who work in public service jobs like teachers, firefighters, and law enforcement officers. These workers, who are often left with reduced Social Security benefits due to the Windfall Elimination Provision, WEP, will see substantial increases in their payouts under the new law. The adjustments are designed to address long-standing issues where these workers have been penalized for not paying into Social Security through traditional payroll taxes, despite contributing to other government programs like pension systems. In addition to the regular increases, some of these workers will receive back pay to make up for the years they were underpaid due to the WEP. This back pay is a crucial aspect of the Fairness Act, as it compensates for the financial losses that these workers have endured over time, which could amount to thousands of dollars in some cases. The changes are aimed at ensuring that public service employees who have dedicated their careers to serving their communities will receive fairer treatment when it comes to their retirement benefits. However, these benefits come at a steep price. The Social Security Fairness Act adds an estimated $196 billion in costs to an already struggling program. This has raised concerns about the long-term sustainability of Social Security, which is already facing significant financial challenges. Critics argue that, while the law is a positive step for public service workers, the added financial burden could worsen the program's financial outlook and further delay the necessary reforms that could prevent Social Security from running out of funds in the coming decades. The debate continues as lawmakers and experts grapple with how to balance fairness for public service workers with the financial health of the Social Security system as a whole. In 2025, Social Security beneficiaries can expect a cost of living adjustment, COLA, of 2.5%, which translates to roughly $50 more per month on average. This increase is intended to help seniors and others reliant on Social Security keep up with rising living costs, particularly due to inflation. However, the actual impact of this adjustment may not be as straightforward as it seems. For many beneficiaries, the extra income might not significantly improve their financial situation. While $50 might sound like a welcome boost, the increase could be offset by rising healthcare costs, particularly Medicare premiums. Medicare premiums are expected to rise in 2025, potentially swallowing up much or all of the COLA adjustment, leaving recipients with little to no net gain. The reality for many Social Security recipients is that despite receiving this COLA increase, their purchasing power may not improve. With healthcare expenses taking a larger share of their income, especially for those with Medicare, the additional $50 may barely cover the increase in out-of-pocket medical costs. In some cases, retirees may find themselves in a worse financial position, with rising costs for essentials like food, housing, and healthcare outpacing the modest raise in Social Security benefits. This is a harsh reminder that the COLA adjustments are often not enough to keep up with the full impact of inflation, especially for those living on fixed incomes. Moreover, the COLA is designed to help all beneficiaries keep pace with the general rise in living costs. But it does not always account for the specific expenses that retirees face, such as healthcare, which typically rises faster than general inflation. The 2.5% increase may not be enough to address the real-world challenges that many beneficiaries are dealing with, particularly in light of an aging population that requires more medical care as they get older. As such, many may find themselves facing a difficult balancing act, trying to stretch their Social Security benefits further while dealing with rising medical and living expenses. For those on Social Security, it's important to recognize that while the COLA increase might seem like a positive development, its real impact could be minimal, and for some, it may not improve their situation at all. The debate over whether COLA increases are sufficient to address the needs of seniors and other beneficiaries is ongoing, especially as healthcare costs continue to rise and inflationary pressures persist. There has been considerable discussion around the potential elimination of taxes on Social Security benefits, particularly fueled by political promises such as those made during Donald Trump's campaigns. Proponents of this idea argue that removing taxes on Social Security would help put more money in the pockets of retirees, enhancing their financial security and allowing them to enjoy the benefits they have earned. For many individuals receiving Social Security, the idea of not paying taxes on these benefits is appealing, especially considering the financial strains many face as they rely on a fixed income. This could mean additional disposable income for beneficiaries, which would be welcomed by those struggling to make ends meet. However, critics of eliminating taxes on Social Security benefits warn that it could have serious consequences for the program's long-term health. The Social Security system already faces major financial challenges, with experts predicting that without significant reforms, the program could run out of funds as early as 2032. By eliminating taxes on benefits, the program would lose a vital source of revenue, potentially accelerating its path toward insolvency. This could result in an even greater strain on the Social Security Trust Fund, leading to automatic benefit cuts for all recipients in the near future. The loss of tax revenue might also force lawmakers to either cut benefits or raise taxes elsewhere, burdening future generations. Adding to this concern is the ongoing debate about how the government should handle the rising costs of Social Security, which has been a central issue for years. The removal of taxes on Social Security could further deepen the system's financial gap, potentially exacerbating its solvency issues and putting more pressure on lawmakers to find solutions that could involve painful cuts or tax hikes. While the immediate benefit of tax elimination might be appealing, it could contribute to a much larger financial crisis in the long run. As Social Security's future becomes more uncertain, another significant factor is the looming insolvency of the program, which experts warn could happen by 2032. If Social Security goes insolvent, beneficiaries would face automatic reductions in their benefits. These cuts would not be small. They could amount to a reduction of about 20% to 25% of benefits for current and future recipients. This scenario underscores the urgent need for reform, and without changes, millions of Americans who rely on Social Security for retirement, disability, and survivor benefits could see their financial security dramatically reduced. Another critical concern is the pressure facing the Social Security Administration itself, which has been operating under tight budgets for years. Budget cuts to the agency could lead to a decline in the level of service provided to beneficiaries. Social Security recipients often rely on the administration for assistance in navigating the complex system, addressing issues with their benefits, and resolving disputes. If the agency's funding is cut, wait times could increase, customer service could suffer, and the quality of assistance available to beneficiaries could decline, creating a ripple effect of challenges for those who depend on these services. Lastly, there is an ongoing conversation about changing the method used to calculate cost of living adjustments. Currently, the adjustments are based on the Consumer Price Index for all urban consumers, CPIU, which may not fully reflect the needs of retirees who often face higher healthcare costs than the general population. The proposal to use the Consumer Price Index for the elderly, CPIE, could result in larger COLA increases, potentially offering more financial relief for older adults. While this shift could provide more support, it also presents its own set of challenges, as it could place additional strain on the Social Security system.